I am Haley Ship, and I am the Communications Director with the Ranchers Stewardship Alliance. So nice to have you with us tonight. This is session number 2 in our Rural Resilience series, and this is the 6th year that we've been doing this series. And so if you think back to 6 years ago, big COVID time, and we were actually kind of on the top of our game right then, bringing in webinars when COVID was first setting in, and we have stuck with it with this webinar. And we're excited that the platform and this evening time is still working for some folks. And we know you're busy, and we know some of you are likely multitasking as you're doing this evening, but we appreciate you spending the time to be with us. We do also take these webinars, record them, and put them on our YouTube channel as well. And so if you missed the one from 2 weeks back, if you have to bob in and out tonight, maybe if you're thinking, I would like somebody that does some work on our operation to watch what Dr. Katie Rein had to say, you can head on over to the Ranchers Stewardship Alliance YouTube channel and get the replay of that. So we do want to mention tonight, we've got some sponsors that have helped to bring all of our educational content and more to you here in 2026. And those do include VSEF Cattle Company, as well as Stockman Bank, AgriBest Feeds, Montana Livestock Ag Credit, Vents, and AgSpire. So if you see anybody from those businesses, make sure to give them a hearty thank you for helping to bring this educational content free to you this evening. We've got many opportunities that are also free throughout the year, as well as some very low cost opportunities, very much lower than what the charges would typically be. So we're very thankful to them. Still coming up this year in the Rural Resilience series, we've got coming up on February 19th, we're looking at water, and that's low-tech, high-impact restoration. This is sort of those beaver dam analog type projects where you're using just what's there on the land to raise the water table by mimicking what a beaver would do. Not trying to attract the beaver back. Common misconception with that. But that's going to be our discussion on the 19th of February. And then on March 5th, it's the 4th session of this Rural Resilience series. That one's going to be all about the sheep industry. We've got Brent Rader, who is with Montana State University, and he's going to be giving lessons that he thinks that the beef industry could learn from the sheep industry. And so excited to have Brent with us for that one. It was a discussion that he had previously at an event. We saw it on the docket, and we thought, you know what, at that Next Generation conference last year, he talked about it, and we knew it was something that we wanted to bring to you all as well. So excited to bring Brent for that one. Still coming up on the calendar as well, if you are in the Ranch Stewards Book Club, here is your reminder. We are meeting on Monday for that discussion of Piece of Land by Brent Turner. Now, this book is all about estate planning and succession planning and the importance of it. It's told as a fiction book, but very much with life lessons that I know many of us in agriculture can relate to. We're going to have that discussion February 9th from 7 to 8:30. Even if you haven't read the book, if you want to hear some insight just from your peers about succession planning and what they gleaned from this read and what it kind of opened up for them, you are more than welcome to join us. You don't have to read the book to take part in book club. ranchstewards.org is the link to get the information for that one. And then we are going to be bringing the author, Brent Turner himself, along with 2 other folks that are in this arena that we all know well. That's Ariel Overstreet Adkins. She's an attorney. And then Kurt Barnikoff, retired CPA, to talk about ranch succession planning in a panel. It's part of our Lunch and Learn series, and that one's going on from 1 to 2:30 the afternoon of February 23rd. Mary Oxart is serving as our tech support tonight. She's also the one that puts this calendar together as our education program manager. And as you can tell with everything I just said, she has had a very busy last 6 months getting this all set up. But we're excited to bring all of this education to you. With that, I'll quit talking. Let's start talking about the education that we're going to be into tonight. We've got Dr. Katie Rein on standby. Katie grew up on a ranch west of Melville, Montana. Melville, not Melstone, and it's been in her family since 1893. Now, after leaving home, Katie pursued her education at Montana State University, earned her veterinary degree from Washington State University, and then completed an internship in large animal medicine at Texas A&M. Following that internship, Katie worked for 2 years at the Harlowton Veterinary Clinic before founding Crazy Mountain Veterinary Service. She has found great joy in watching the practice grow from a one-person operation to a dedicated team of capable colleagues working together across multiple locations. Sharing responsibilities with her team has allowed Katie to continue doing the work she loves while also creating space for other passions. Outside of veterinary medicine, for her, that looks like helping her husband, Jason Luce, on his ranch in Hobson, spending time on the lake, getting her private pilot's license, and taking an occasional true vacation rather than just traveling solely for continuing education. Now, Katie is also actively involved with the Montana Veterinary Medical Association through the Power of 10 initiative and serves as a governor-appointed member of the Montana Board of Veterinary Medicine. Doesn't let the grass grow beneath her very long. So, Katie, I'm going to go ahead and turn it over to you tonight.
Great. Thanks, Haley. That was a great introduction, and I will go back to sharing my screen again. So as Haley said, I'm the owner and a veterinarian at Crazy Mountain Veterinary Service, and part of our mission is to empower ranchers to produce healthy, profitable beef. And because of this, when people ask me to do educational things, I try to do them whenever my schedule allows. So a Zoom meeting is definitely very convenient before people get going calving and whatnot. So here we go. This is what I put together, and I hope it's what you were looking for. Oh, there. Oh, I went too far. Okay, so the first thing, and this is kind of the main point that I want you to remember, is to treat your vaccine like you treat your favorite beverage. And I thought about having a beverage while I was sitting here, and I thought maybe that wouldn't be very professional. But number one, keep it cool. Nobody likes to drink warm pop or a warm beer. Don't let it freeze. And actually, freezing is harder on vaccines many times than getting it a little bit too warm for a while. So not that we've had that much trouble with it this winter, but I'm sure you can all remember times when the vaccine kept freezing as you were giving it. So we need to really try not to let it freeze solid. And especially if you find frozen vaccine in your fridge, it needs to go away. One time we had a cooler just like this full of vaccine, and it was a brand new fridge. And we kind of ignored the alerts that it was freezing, and the whole thing froze up. So it was a very expensive mistake for our insurance company, but just try to monitor your vaccine and don't let it freeze. So that might mean coolers with ice packs in the summer, or a hot water bottle. And you shouldn't shake it vigorously. Like, it really bugs me when I see people going like this with vaccine, because vaccine can be fragile. And so when you're doing that, you can be breaking it apart into different components. So you really need to be rolling it or swirling it gently, but don't shake it vigorously. Just as you wouldn't shake your beer or your pop vigorously. Another thing is you need to consume it immediately. So no one opens up a beer and they set it on the back of the pickup and maybe drink it in 2 or 3 hours. It should be consumed immediately. So mix only what will be used in the next hour or up to 2 hours. Additionally, you need to protect it from light. So many modified live vaccines can be inactivated by light in as little as 15 minutes. So if you have a mixed up bottle, it needs to be protected from light. A lot of the vaccine guns have a little bit of shading just to help with that, protect from UV light. I wanted to show a few different ways of mixing up a modified live vaccine, which everyone knows how to do. There's the metal transfer needles or the plastic trans clips. And I kind of like the plastic ones. You can actually put it together and let it, and just set it on a flat surface and let it run together. And they don't seem to get clogged quite as much as the long metal ones that you need to use a paper clip or a long needle to unplug the rubber stopper out of it. Generally, when you're mixing, you put the transfer needle in the liquid first and then into the powder. Now, the only caveat to that is the Vista vaccines by Merck. They send a transfer needle with that and they send instructions, which the first several times I did it, I had the instructions out. And I always like to say to people, my dad could do it, so you can do it if you follow the directions. So basically, you put the transfer needle that they provide in the powder first or the cake first, and then you put the whole thing, the other end, into the liquid, and then you turn it over and you squeeze some of the liquid into the powder and swirl it around to let it help it dissolve, and then you put it back in the plastic bottle. So it's opposite of most vaccines, and the vaccine you're using ends up in the plastic bottle. It wouldn't all fit in the glass bottle. The reason they do that is because they can fit more of the smaller glass bottles in the freeze dryer, so it saves them money in their manufacturing process. But I complain about it all the time because our producers have in the past had a hard time changing their brain between different vaccines. Which one do you put in the liquid first? Which one do you put in the cake first? So generally, you should always put the transfer needle in the liquid first to not lose the vacuum, but Vista vaccines by Merck are opposite. Another thing I wanted to talk about, and this is just general getting ready to vaccinate animals, is it's a good idea to label your syringes. So for one, I have, and other people have in the past, wasted a lot of vaccine by accidentally pulling up the wrong vaccine in the wrong syringe and mixing the vaccines. So if you label the syringes, that probably won't happen. Some people use different colors of tape or just a permanent marker or a tag pen or something to label them. Another thing about labeling them that can be good is if you put modified live on one, then maybe you only put modified live vaccines in that syringe. If you put killed in one, you might only put killed in that. If you use a repeater syringe like this to use antibiotics, you would only use that one for antibiotics and you wouldn't put vaccines in it later. Because potentially, if there was traces of the antibiotics in the syringe still, it could inactivate the vaccine. These are some commonly used vaccines guns, the Allflex style and the Hapner style. There's also bottle mount vaccine guns that are pretty convenient when you're vaccinating a lot of animals. And then there's also, oh, that one didn't show up so good. There's the kind that show up on that you can hook a tube to and you can hang the bottle from the syringe. You're gonna want to lubricate the plunger before you start vaccinating cattle. You can use vegetable oil or a medical grade syringe lubricant. Either one works well. You also want to examine these O-rings and look for nicks or tears in them, because if they have a tear, if they have a nick even, they can leak a lot of vaccine back and waste a lot of vaccine. You also need to restrain the animals. So there's definitely times when it's a lot easier to just run down the alley and vaccinate calves, especially, or even cows. It's just a lot harder, especially if you're giving more than one vaccine, to make sure that the vaccine goes in the right spot and each animal's getting a full dose because they're moving around. So it's a good idea when you can to restrain the animals before vaccinating them. And this could be at a branding, it could be wrestlers, it could be Nordforks, it could be a table. It doesn't have to be a squeeze chute, but they just need to be restrained somehow. So now we'll just do a quick review of the different routes of giving vaccinations. And so some of them aren't actually injections. You can have oral vaccines, intranasal, intramuscular, subcutaneous, or even intravenous, which isn't used very often. Before you start vaccinating, you need to read the directions, and I can't stress this enough. I don't know how many times we've been vaccinating and we've got partway through and realized it was supposed to be giving IM and we were giving it sub-Q, or we needed to change the gun. It was set on 5 and we are supposed to be giving 2, or the other way, we were giving 2 and they're supposed to get 5. And so think about reading the directions first, just to confirm, even if you've done it a million times, just to confirm. Needle selection will go through under each type, and then we'll also go through injection sites. I want you to think about the lymph nodes and where the vaccine is going after you give it. Of course, we'll talk about beef quality assurance. We'll talk about if you're giving two different vaccines to do them 4 inches apart or a hand's width apart, and then how often to change needles or nasal cannulas. So the first one we're going to talk about is oral vaccines. So they're given by mouth, and this is a modified live oral vaccine. So you have to mix up each one of these bottles, and then you squirt the whole thing in the calf's mouth. And this is typically done very soon after they're born, and it helps prevent against scours. So there aren't too many oral vaccines, but there are some. The next is nasal vaccines, and there's actually several of these on the market. So sometimes they're shortened by IN, and usually the dose of them is 2 cc's. So the question I get a lot is, do you put both cc's in one nostril or 1 ml in each nostril? And you can do it either way, but the studies that I've seen show that it works just as well if it goes in one nostril, and it's a lot easier just to put it in one nostril. So that's what I tend to recommend, is to put it in one nostril. It comes with cannulas, and generally it comes with enough cannulas that you could change the cannula on every animal. However, a lot of people don't do that, or some people will even do a whole bunch, but it is good to get in the habit of changing the cannulas, because if you think about it, if you're moving an object from one animal to another animal's nose, and that animal is sick and it's spread through the nasal secretions, you're just going to spread diseases by trying to give a vaccine that's supposed to prevent diseases. So you need to keep that in mind. Subcutaneous. So subcutaneous is sometimes abbreviated as SQ or SC. I generally recommend a 5/8 inch needle for this, but even up to 3/4 inch. And then the gauge is 16 to 18 generally. If you're going to do sheep or small calves, you might even go down to a 20 gauge needle. So in gauges of needles, the lower the number, the bigger around it is. So a 20 gauge needle is very fine. And generally, I only use those on sheep and horses. Although some people use them on cattle, they just bend easier. And I like to go in at an angle, as this picture is kind of showing, kind of a 45-degree angle, and inject the vaccine right under the skin. So in that light pink spot that's between the skin and the muscle. So here's a picture showing a skin tint. And I want to bring it up because I know a lot of people are trying to do a skin tint, and that's kind of been touted as the best way to do a subcutaneous vaccine. But I really do not like this, and I really discourage people from doing a skin tint. For one, you can see on the picture with the live calf, your hand is right there. And if something gets thrown around, you could very easily stab yourself, possibly even inject some vaccine. And some of these vaccines can cause some pretty major tissue damage to a human. So I'm not a fan of the skin tint. I am a fan of going into the animal at an angle and reaching that subcutaneous space. And you can feel when you're in there. And sometimes you can even move the needle a little bit just to make sure you're in the right spot. The next one we're going to talk about is intramuscular or IM injections. Typically, you're going to want to use a 1 inch or 1.5 inch needle for this. And also in cattle, we're generally going to use a 16 to an 18 gauge needle. Maybe at times on larger animals with a really thick substance, like some of the antibiotics, you might even use a 14 gauge needle. But you're just going to go straight into to inject it into the muscle. Intravenous, we don't do very often, and it's kind of hard to see on this picture, but the pink glove is holding off in the jugular furrow, and that's allowing the vein to fill, which is a little swollen area right there, and and then you can see where to inject IV. So there's very few vaccines that are injected IV and not really any that are commonly used on ranches. So now we'll get into some of the beef quality assurance stuff about where to inject. And we want to inject in a safe area for the animal, so we're not going to cause any adverse tissue damage. And we want to not inject in valuable pieces of meat. So we're going to not inject anything in the butt, and we're going to try to do everything in the safe zone, which is the blue and green area. So the top of the cow in that triangle area is the nuchal ligament, and that's what connects their head to their withers. And you don't want to inject there because it's a very fibrous structure and it's not really going to absorb the vaccine, and it could even cause some reactions. And then underneath that is the spinal column, which seems kind of crazy that it's that low, but it does go there. So you can sort of follow that down above the jugular furrow, which is the dip in their neck, and you can give the vaccine above that. And then the other part of the triangle is the shoulder. So you're going to want to avoid all the areas in red. And this is what it looks like on an animal, just those same landmarks, but on a live animal. So I mentioned earlier that I wanted to discuss the lymph nodes, and I want you to think about the lymph nodes when you're giving vaccines. So this is just showing the lymph system of a cow, and the black dots are lymph nodes, and then they're connected by black lines are the lymphatic vessels. And so when you give a vaccine, it doesn't go directly in the bloodstream when you're giving it sub-Q or IM. It's absorbed into the lymph and it goes to a lymph node where it's processed. So we don't want to overwhelm the lymph nodes with too many vaccines. So if you're giving 2 or 3 vaccines, you're going to want to give them on either side of the neck, and the ones that you have to do on the same side, you're going to do a hand's width apart so that they're not too close together, so the tissue can absorb them adequately. How often do you replace your needles? So this is a fun picture that I found from the Iowa Beef Checkoff, showing an electron microscope picture of a needle. So the top left is the needle that hasn't been used yet. So you can see it's really clean and sharp. And then as you go, it's with more uses. So even just with one needle stick, there is every time there's a little bit of damage to the needle. And so when I'm processing a lot of animals, I kind of shoot for, if I'm using a 2cc shot, and I often use the 25 mil repeater guns because then I can feel myself giving a shot a little bit easier. So on those, I often replace every time I fill my gun if I have time. So that's usually around 10 to 12 animals. If I don't have time, maybe it's every bottle, which when we're bangs vaccinating, it's a 25 dose bottle. Or if you're using other vaccines, it's probably a 50 dose bottle. So you're at least going to want to change every time you start a new bottle and go into the bottle with a clean needle. There's 2 reasons for that. One is just to not contaminate the vaccine. And then if you have some left over of a killed vaccine that you need to use another day, it should be safe to use on another day. Oh, and I always have to tell this story, and my sister's not on, so I can tell it. My sister came with me to Bangs Vaccinate, and I didn't do a whole lot of training because I knew she knew how to vaccinate. And after we'd done about 150 head, I said, "Hey, where are you putting your used needles?" And she goes, "I'm still on the first one." So it's a good idea to make sure that your whole crew knows how often to change the needles, because you can use a needle for a long time. Some common problems that I've noticed when I'm vaccinating or when my ranchers are is once in a while blood will leak out of the hole after you inject it, and that's not normally a problem. There's not too many vessels right subcutaneously that could absorb enough vaccine to cause a reaction. Another thing I see a lot is vaccine leaking out. And that can be because the skin is too tight, like if they're caught tightly in the chute, or maybe you stretch their neck out a little bit in the chute and their skin's really tight. It seems like if you give a subcutaneous injection, a lot of it leaks out. Another reason for it leaking out can be air bubbles. So if you have the air bubble in the top of your syringe, then it can leak out. And so everyone knows that one way to get air bubbles out is just to point the vaccine gun up in the air and squeeze on a little bit and let the air out. But I'm Norwegian. I'm very Norwegian, and I just cannot hardly handle seeing all the vaccine going into the air. And then also, I've been at places where someone did that so frequently that we almost ran out of vaccine because there was the drops add up to mils and the mils add up to doses. And at the end of the day, you could run out of vaccine. So what I do is if I have an air bubble, I hold the bottle upside down and the syringe upside down, and I just squirt one dose back into the bottle. And then that's how I get rid of the air bubble. And I don't always change the needle every time I do that, but I would if it was the last, like if we were going to be done, it was the last bottle and we might use it another time, then I would probably actually squirt it into the air just because I wouldn't want to go back into the bottle with a dirty needle. So speaking of needles, basically if a needle is bent, if you drop a needle or drop a syringe, or if it's contaminated, like another vaccine or something like that, those should all be replaced right away. Don't wait until you get to the time to replace it right now. A dirty animal, I also wanted to talk about. So sometimes animals come in and they're so covered with manure that you can't find a clean place to give the shot. And you need to keep looking and try to find a clean place. If you can't find one and you can't clean it off, you should try to clean it off. And then you should also change your needle after giving that animal an injection. Needle disposal. So something that we kind of tend to gloss over is the proper way to dispose of needles. So there's sharps containers that I actually see on ranches sometimes, and we used to have them here. But I did some research in the past couple of years, and I found out that according to the Montana Department of Environmental Quality, you can put them in a puncture and leak proof container like a liquid laundry detergent jug. So we've started using those a lot more just to kind of help recycle those containers and to not have to buy sharps containers. But if you use that, you have to write the word sharps on the outside. You can't fill it all the way full. You should add some bleach to the container so that if there's any live vaccine in there, it would disinfect it. You need to seal it with the lid and then put a whole bunch of duct tape over it so that it won't come off and it won't spread needles all over when the dumpster people are picking them up or on the ground. And then you can just throw them in the garbage, and that's what we do. So you just want to think about, you don't want someone else to get stuck with a dirty needle. They don't know that it came from an animal or a human. And even if it came from an animal, there are diseases we can get from animals, and they're obviously dirty. And so we can just get localized infections. So those are good ways to dispose of needles. Cleaning syringes. We're going to just go through how to clean syringes, how you can heat sanitize them, and then how you can store them at the end of the season. So cleaning syringes, you should clean the exterior in warm tap water, and you can use soap on the exterior. You wouldn't want to get it up to the tip of the vaccine gun, but you can get it on the handle or things that can get very dirty. And then rinse it well so that there's no traces of soap left. And then for the interior, you never want to use soap. You want to use hot water, rinse it 3 to 5 times. You can sometimes have a container, a clean container, and suck the hot water up and really get it moved back and forth with some force. Or you can take everything apart and rinse it all with hot water. And this is just a reminder that it's so important not to use soap, not to use any disinfectants, And in fact, even like if you're using nasal cannulas and you're tempted to wipe them off in between with a disinfectant, that's not a good idea either because it could possibly inactivate some of the vaccine before it went into the animal. To sanitize the vaccine guns, you can do the boil method. So you just take them apart and you boil them for 5 minutes. Or you can do the microwave method where you wrap 5 to 10 layers of wet paper towels around an individual syringe or the parts, which you shouldn't really have to do the handle part that you squeeze. You should just have to do the part that's touching the vaccine. If you don't take it all apart, you would have to, or if you have one that like the kind with tubing that doesn't really come apart, you could fill the barrel with water and still wrap paper towels around it. And then you could microwave that on high. But obviously, you have to be careful with putting metal in the microwave. So it has to have a lot of layers of paper towels around it. So that's a little bit more of a process. However, I had to call one of my customers this morning to get this picture that he shared with me several years ago. This is what happens when you set out to boil your syringes for 5 minutes and then you forget about them and go do something else and all the water goes away. Obviously, they're ruined, and it always makes me smile to see that picture because that's totally the kind of thing I would do if I tried to boil them for 5 minutes. Storage. So you need to dry them and cool them in a clean, draft-free space so they're not getting a lot of dust in them. And then you can seal them in a plastic bag, and you can even store them in the freezer if you want to make sure that nothing's going to grow on them. But when you go to use them, you need to bring them to room temperature and rinse with hot water again, just prior to the next use. If you're using the 180-degree water, then you'll have to let the syringes cool before you can fill them with vaccine, since vaccine doesn't like heat. I wanted to talk about protocols, and this is something I actually got from a handout from the BQA guidelines. And it's something that we really have been working have been working on in our business quite a bit, is having protocols for things, because how do you train people to do things if everyone's sort of doing it a different way? And how do you know if it's working or if you're having some kind of a problem because of how something was done? So the first thing for the example that they had listed was review employee trainings to ensure everyone is up to date on protocols. So the example of my sister kind of fits here. I just assumed that she would be changing her needle regularly, and she just assumed that since we're Norwegian, we're supposed to be using the same needle for the whole bunch. And so just go over that with everyone. If you have a new vaccinator, go over these things. Sometimes the vaccine gun gets handed to the least experienced person, and these vaccines are expensive and they're important to be given correctly. So make sure if you have someone new that you do have a protocol of how you're going to vaccinate, and make sure it's communicated to everyone. The third one down is to identify the proper withdrawals. So all of these vaccines that we're giving have a slaughter withdrawal. And so you need to think about that. Like, say you're vaccinating cows and one breaks its leg after that, or you accidentally vaccinated one and you want to slaughter it for your own use or take it to the sale. You need to keep in mind the slaughter withdrawal on that. I think. Oh, another one I wanted to touch on. So how to give the vaccinations, how to handle the vaccine, what to do with it when you're not filling your gun, things like that. Low stress cattle handling. So that's another great way that you can train new people that are there to help. And this is just showing a reverse parallel, how you encourage animals to move down a single file alleyway by moving past their point of balance so that they'll want to move past you. And you can really reduce the use of a hot shot quite a bit if you do this triangle where you approach them at their head, move past their point of balance, they move forward. And then when you want them to stop or you don't need them to go, then you leave their flight zone and then come back and do it again. And I really notice this at the sale barn when we have helpers there that get it and they do this, the cattle flow a lot better than when someone's just standing there with a hot shot, waiting until one won't go and hot shotting them. And you should always be focused on the one at the front. A lot of times the other ones will trickle in, and the one at the front is the one that you need to get into the chute so that you can get done at the end of the day. The other thing about low stress cattle handling is that they may respond to the vaccines better if there's not a lot of cortisol in their system. So if there's a lot of stress, a lot of yelling and clanging and banging and hot shotting, they may not respond to the vaccine as well. So when we get into some of our protocols as far as vaccine selection, how much is too much? So I was trained that not more than 2 gram-negative bacteria in dairy cattle, and that beef cattle can take 3. So normally I allow people to give 3 gram-negative bacteria, and I've listed some of the common ones that you'd use. So Somnus, Pasteurella, Leptovibrio, pink eye, bangs vaccine, foot rot, scours, and salmonella. So if you think about it, a lot of people with stockers, they might be wanting to vaccinate them for foot rot and pink eye. So there's 2 gram-negatives. And if they wanted to add a Somnus, we could do that too. But if they want to add a Pasteurella on top of that, that's probably going to be too much for them. Or even if you're vaccinating pregnant cows, you've got the Leptovibrio. If for some reason you're vaccinating for pink eye or foot rot or something like that, you want to keep that in mind when you're vaccinating them. And I've never been a huge fan of using Somnus in baby calves like at branding age, because I think it is harder on them, and I'd rather have them have the Pasteurella. But you can add it. It's still not more than 2 gram-negatives, which is fine in a baby calf. But you would not want to add a pink eye and a foot rot if you were already doing the Somnus and the Pasteurella. You would want to keep it as those 2 in a baby calf and not go to 3. So what would the adverse reaction be if you had too many gram-negatives, or two? It could be an adverse endotoxin reaction, which could just show up as fever, kind of punky, lack of appetite, but they could even die. Another thing that happens, and this isn't necessarily people that give too many gram-negatives, it can happen whenever you're vaccinating anything. Actually, whenever you're giving any kind of an injection, but it's more common with vaccines because we're trying to stimulate the immune system, but you can stimulate a type 1 allergic reaction or a hypersensitivity response. And those calves, they'll go lay down or stand around away from the herd. They'll have rapid shallow breathing, sometimes muscle tremors, sometimes their face will swell up. They'll start drooling, staggering around. Usually they lay down or collapse. And then if you don't treat them, most of them will die if it's a true hypersensitivity reaction. And normally this is within 10 or 30 minutes after injection. So you can monitor them, just keep them in the corral, keep an eye on them, which most of the time you're processing other animals, but you might want to check the ones you've already processed. And if you have epinephrine and dexamethasone, most of the time you'll get them out of that reaction. But if you don't have that, most of the time they'll die if it's a true hypersensitivity. Other adverse reactions are just lumps and bumps where you gave the vaccine. Some things that can promote lumps and bumps a little more are just some of the adjuvants in the vaccine that make it cause a good immune response. They can cause some lumps. Sometimes if you have a dull needle, that can cause a little bit of tissue irritation that can cause a lump or maybe even an abscess. If the hide is real dirty, things like that. And often they will be stiff and sore after a vaccine. I know whenever I've got vaccinated, I've been stiff and sore, and that's your body responding to the vaccine. It's just going to have a little bit of soreness, especially for intramuscular injections. So getting the most out of your vaccines, I already mentioned that a lot of these are expensive and a lot of them are important as far as the future success of the animal's health. And so you're going to want to time the vaccines to avoid stress. You're going to want to not mix them up too early. You're going to want to give the vaccine the best chance you can to work. You're also not going to want to vaccinate when it's really hot. So those adverse reactions we talked about, they're going to be more problematic when it's really hot outside, like above 85 degrees. So you think about summer days, it's worth getting up early and processing the calves first if you're doing calves and cows, because they're going to have more stress from the heat, and getting those done before the day really heats up. Another thing that's very important to think about, and we think about often when we have an unfortunate outcome, like we still have a herd that breaks with a disease, even though they were vaccinated, is the nutrition. So are they in good shape? Do they have enough protein and energy? And then what about the really important minerals to the immune system? Selenium, copper, zinc, cobalt. Are all of those things adequate? And many times we'll even do liver biopsies or blood tests to look into the herd to see if they do have adequate levels of those micronutrients. Parasites. I have had cases where animals did not respond well to the vaccine because they were fairly heavily parasitized. So if an animal has parasites, their immune system is going to try to fight off the parasites, but that's one branch of their immune system. And the branch of their immune system that's going to fight off respiratory disease is another branch. So if all your cells are focused over here and you need them over here, it's not going to work as well. So deworming, especially of young animals, can really help them respond to their vaccines better. So this is just a fun cartoon that we made with a couple of my clients this fall. And I don't know how many times I have heard this when someone yells to the guy running the chute, "I told you I was filling my gun." And our joke is, damn those Costco hearing aids anyways. But take advantage of downtime. And one of my assistants just reminded me of that today. Like if there's any delay, you should have all your guns full. You should have all your needles changed. You should be ready to go so that when everything's flowing smoothly, it can keep flowing, and no one has to stop and wait for you to fill your vaccine gun. It's kind of like playing ready golf. Protocol drift. So this is something that we talk about with some of my clients, is that you have all the best of intentions to have these protocols to do things right. And then over time, we tend to revert back to our old habits. So you might want to think about having some of this written down, or having some sort of a cue to help remind you to change your needles or to not shake up the vaccine, whatever it needs, whatever works for you to remind you that these are your protocols. You have them set up for a reason and you want to keep doing them that way. Or if they're not working, you should change them so that you're not just slowly drifting back to something. You're intentionally making the decision to change your protocol. So in review, the main takeaways that I want you to leave with is to treat your vaccine like your favorite beverage. Don't let it get too hot, too cold. Don't let it sit out. Just basically treat it with care. Treat your vaccine with care. Do a little bit of a pregame, read the label, set the guns, make sure everyone's trained up on knowing what they're doing. Consult with your veterinarian to create a vaccination protocol for your herd. So if you've never talked with a vet about your vaccine protocol, it's a really great idea too. We consult with many ranchers. If they have any problems, we sit down and we talk about other things we can do. And we enjoy doing that because that's how we really feel that we can help people's bottom line. Some of the other things that we do are just a band-aid or just herd work or things that are important to do, but we can really save people money by having the appropriate vaccination protocol. So that's something that our clinic enjoys doing, and I'm sure many other veterinarians across the state would. And then just to be ready, if you have a minute, make sure that you're ready so that when the calves start rolling, nobody's waiting for you. So I forgot I was going to do a little part about dart guns. Sometimes dart guns are called a remote delivery device, and we don't use them so much for vaccines. It's generally to sedate animals or for treatment with an antibiotic, but these are just some tips. So practice so that you're not hitting them in a bad spot. I was just having a chat with a producer this afternoon, and he heard on the a story on the radio, which is super because it's always great when we hear that we did that bad things on the radio. But at the slaughterhouse, they'll find these darts completely embedded in muscle. And he told me they found one in the lungs of a cow. So obviously, those were not appropriately shot at the animal. You also need to use the appropriate size of dart for the dose you're doing. So it's best if you can choose, like if you're giving a 7 cc shot, choose a 7 cc dart. The biggest they go is 10. So if you have to go more than 10 cc's, you'll have to use two darts, and it's best to use them on two different sides of the neck. You're supposed to aim for that triangle on the neck that we talked about, just like giving a shot in the chute. You don't want to be too close, and I have definitely been around when we were too close and we shot an animal and it embedded the entire dart, which you know how long they are, into the animal's muscle, and we pulled the whole thing out after it was sedated. You want them to be broadside, not moving, so you can get a good shot and go straight in. The picture is supposed to show that you don't want to be more than a 45-degree angle from the animal, because if you are, those are the ones that glance off. You don't know where they go. They can be hard to find. They could possibly hit another animal or even a person or something. So just try to go straight in if you can. But if it's a little bit quartered away or towards you, at least don't go more than a 45-degree angle. And that is the end. So now it is time for the questions.
Great, Katie. Thank you so much. That was very informative. Now we just need you to have that session, 30-minute time block before everybody works cows. You can set everybody down, get them their protocols, and we can just all hire you to be on site. Did have some questions that are starting to come through, so I'm just going to start to read through some of those. The first being a comment from Gene. He says, this is more of just kind of a statement, but a reminder that if you're cleaning that syringe with water and it's got a rubber gasket or an O-ring, he says you should oil or grease that gasket before storage and that will prevent dry rot. Katie, did you have any other? I know you said, no soap is a huge thing. You don't boil them and leave them in the pot and on the burner. But I'm sure just making sure that you let them thoroughly air dry before you tuck them away, and you clean them when you go. You don't have to clean them again then when you go to vaccinate that next time, do you? The one time is just good enough.
And I was going to actually comment on that too. I'm glad you brought it up. So if you're processing several days in a row and you have them labeled like this is a modified live, this is a killed, you don't have to do the whole sterilization thing each time. You do the cleaning thing each time because that's how you take care of your guns and they last longer, but you don't have to do the entire sterilization, put it in a plastic bag, put it in the freezer, all of that. That's more like at the end of the season when it's going to be weeks to months before you're using it again. And yes, you definitely need to lubricate the O-rings before you store them, or you'll be sad the next time.
So you did talk about kind of vaccine efficacy once you get to those warm temperatures, but is there any uptake of vaccine information related to the outside temperatures when it's too cold?
Um, well, when it's too cold, it is a struggle to keep the vaccine warm, but although warm enough that it's not freezing in the needle. And it really depends on the vaccine, but any vaccine that has the gram negatives in it, if they freeze, those vaccines can actually cause an endotoxin release. And so it can make those vaccines really hard on an animal. So yes, definitely freezing can reduce the efficacy, especially of gram-negative vaccines.
So of course, I mean, you keep them inside your coats and you kind of try to keep the vaccine warm when it's cold outside. There are people that have the fancy coolers to keep the vaccine cool, and you can keep the gun in. You had the photo of it there, and of course, we want it to keep it as cold as our beer or our pop. But I mean, realistically, do you need to go back to that cooler between every animal? Is it if you have a lag in time? I know some people can be pretty nitpicky about getting that vaccine gun right back to that cooler ASAP.
If it's cold enough outside, you'll be sad if you don't go back to it every time. Um, just because things freeze so fast. Although I like to say maybe we shouldn't be working cows on those days when it's that cold. But yeah, even sometimes if you try to leave it out for two or three animals, and you can almost tell, like you normally when you squeeze a vaccine gun, it makes a click, and what stops making that click, usually that's when it's just about to freeze up, and so you better get it warm again. And so you don't have to have the fancy coolers for years. We've just taken a styrofoam cooler, which there's always some around, and cut a hole in the top the same size as your vaccine gun fits in there, and then just take a glass jar full of hot water and put that in there, and that keeps it plenty warm and keeps it from freezing up as long as you put it back in pretty much every time. I'm not saying, like, if the temperature is a little bit on the edge, if it's not super cold, you can try it, like leave it out for a few and just make sure it doesn't freeze up. But if it freezes up, then you're sad because you have to change the needle. Sometimes you have to dig the ice out of the tip of the syringe. Usually you end up wasting vaccine because you're trying to get it jammed through there. So you just have to kind of see how the day is going.
And I'm thinking too on the reverse, Katie, of on the warm days, like how important it
Oh,
is to plop it back into a cooled cooler too, if you can
okay.
go
So on the
between
warm,
multiple calves or
right, on the warm days, if you're processing animals fast, I don't think you need to put it back in the cooler. Keep in mind the 15 minutes. So if you have a small syringe and you're like, I really like the 25 cc ones for a 2 cc shot. So you're drawing up 12 doses basically. There's most of the time, unless something's going bad, and in case something's going bad, you're going to want to put the vaccine gun back. You can just roll with that and just keep giving them away, and then you're going to fill up again, and that vaccine has been protected out of the light, out of the sun, in the cool, and so you're getting another go. So it does a little bit depend on how fast you're processing cattle. If you are slow, like if you're doing lots of things, then you should put it back every time. But if you're processing a whole syringe full in 15 minutes, then you shouldn't have to.
so the next one is about sub-Q vaccines and if it's okay to give them in the armpits for calves, lambs, or kids.
I should have brought that up. So, that has been a very commonly used place, and there is really good blood supply there. So, good lymph drainage, things like that. The problem is that if you have a vaccine reaction like an abscess or a lump or a bump, there also is other important things there, that like nerves that run down through that area. So I don't recommend it, but I'm not saying that it's a bad place to do. And that was a really political answer, I realize. The other place that people often or used to, especially with like the alpha 7 or alpha CD, because that does cause quite a lump, it's got a strong adjuvant, is you can give that in the brisket area because there's so much loose skin there that you don't really notice so much if there's a lump. So that's another kind of alternative place. And I hate to recommend things that aren't BQA approved, but there's probably not a huge risk of giving them in those locations.
Then the next one is asking you to talk a little bit more about passive transfer and ideal timing for pre-calving or pre-kidding or pre-lambing vaccinations and why vaccinating newborns isn't always effective.
Okay, that's a good one. And I should have put a chart in there showing the maternal antibodies and how they go down. But basically, if an animal takes in good colostrum and enough of it right after they're born, they have high antibody levels. So say it's up here, and then that slowly starts going down. So over about 4 weeks, by 4 weeks, it's pretty low. And 4 weeks is when we kind of start branding. So that's a good time to, if you brand sooner, right, they're going to be up in here, and some of the antibodies are going to bind to the vaccine and they might not respond as well to the vaccine. So if you wait at least 4 weeks to vaccinate, they should be able to respond well. So that's if they got good quality colostrum. And then their immune system will start to take over and the antibodies will go up after you brand or after you give the branding shots. If they didn't get good quality colostrum, or if the cows haven't ever been vaccinated for anything, for example, say overeating. So this weekend, my husband and I are going to run our cows through and give them a Clostridium perfringens type C vaccine because we've had a lot of trouble with overeating in the past years. And when we do that, the calves never get sick because they're getting those antibodies in the colostrum. When we don't do that, we either just expect to treat sick calves, which overeating can be hard to treat, or we give the calves a shot at birth. Since the cows don't have high levels of antibodies because we didn't set them up for that, generally they will respond to the shot at birth. It just takes a couple weeks for them to get an immune response to the vaccine. So if you have problems less than 2 weeks, then it's not going to really help you out a bunch. The other thing is sometimes people get really gung-ho about giving a lot of shots at birth. And so you think about the maternal antibodies high, a lot of those aren't going to work. The calf is just getting used to life, had the stress of birth, so that's going to make them not work. But saying that, there's a lot of intranasal vaccines that can be given as young as 1 day of age that do have good results because they're just touching the mucous membrane. It's not stimulating a whole systemic response. It's actually stimulating the IgAs, which is in their nostril, not the IgG and the IgM that's going around in their blood. And so it's more like localized immunity. And those vaccines can be pretty useful if you have trouble with pneumonia in calves before branding, before they have a chance to get those shots. So yes, that's a great question. And that would have been a good slide to include in there. I kind of alluded to it with the timing, but I didn't go into detail, and that would have been a good one.
So you said we're not supposed to take that vaccine and shake, shake, shake it in the container while we're doing everything. But with antibiotics, would sloshing of that drug in a doctoring bag affect the potency of the drug?
No, it won't. With antibiotics, no. Like, let's see if I have one. There's some antibiotics that really settle, like penicillin or Exceed, and you actually really do have to vigorously shake them up to get them back in suspension. Otherwise, some animals are getting a really concentrated dose, and other animals are just getting the carrier and aren't getting very much of the dose. So there are some vaccines that it's actually, or not vaccines, there are some antibiotics that it's actually good if they get shooken up quite a bit.
So, Katie, we've got the time, and since we're talking about antibiotics, of course, we have seen some major changes in the veterinary world when it comes to how you're able to give antibiotics out. And so, this could be its whole webinar. It could be a whole day series, I'm sure, talking about this topic. But could you give us kind of just the high points of those changes for what that means for producers on the ground?
Yes, so the changes have actually been several years in the making, and the first change was in order to feed an antibiotic, you had to have a prescription basically from a vet. It's called the Veterinary Feed Directive. And so there was a lot of regulations with that. And when that went into effect, we did definitely decrease the amount, like the tonnage of antibiotics that were used in livestock production because some people just didn't want to talk to a vet, or maybe some of the reasons they were using the antibiotics for were there was other solutions that didn't involve feeding antibiotics. So that was the first one. And then in June, I think of 2023 is when they sent out the other one where there's no more over-the-counter antibiotics. So no more penicillin, no more LA200, no more LA300 that you can just go buy on your own. You have to get it all on the prescription of a veterinarian, which if you have a good relationship with your veterinarian, shouldn't be hard to do. It's just that if you don't, it is going to be hard for you to find antibiotics. And well, all of these changes seem like kind of common sense, that a vet is involved in prescribing antibiotics just like a doctor is involved. I worry about continued regulation and what if it goes a step further, like I can't sell a whole bottle to one herd, that I can only sell one dose to a herd. So I think we should keep a close eye out on what future regulations might be coming. But for now, it has been a big change just having to get your stuff either from a vet clinic or get a prescription from them to buy it somewhere else.
Okay, we're going back to vaccines now. Kathy wants to know, how do you know if a vaccine is gram negative?
Well, the list that I had is pretty inclusive. Or you could just Google what the bacteria in it is and say is Pasteurella gram negative bacteria, and it'll tell you. So that's probably the easiest way.
And then we've got somebody that has questions about the dart gun. They say, do you have any tips? We have a difficult time getting the darts to stick. We are within the range you talked about. We tried both light and heavy loads.
So some of the needles are different lengths, and you might try a longer needle, even though it might not go sub-Q, then it might go in the muscle. But many of the medications we give can be given in the muscle or sub-Q. So you might try a longer needle or try one with a different collar on it. The collar kind of holds it into their skin. And also to make sure that you are perpendicular so you're not going at an angle. And I think those things could help.
So you had talked about the reasons that we don't want, that we aren't tenting the skin because it can put your hand right there at risk of being the next target if something moves. What sort of protocols do you suggest that people have in place should that happen? Because even as safe as we want to be, accidents do stumble in once in a while.
That's a great thing to bring up. So if I stab myself, I immediately wash it out with some kind of a disinfectant, like whatever's there, basically alcohol or chlorhexidine or betadine or whatever's there. I clean it up good, and then just monitor it for swelling. But usually the jabs I get aren't too deep. Although I did get a 18 gauge inch and a half needle in my leg one time, and that hurt for a while. So that's what I personally do. But if someone calls me, sometimes you could get it really close to a joint and you don't always know if it went in the joint, and it could cause a lot of problems if you waited. So if someone like a finger or not in the meat of their hand, like if they've stabbed themselves or injected themselves somewhere like that, I tell them to go to the doctor. Or if it's a clostridial vaccine, it seems like the clostridial vaccines are just really reactive. And so I'll tell people to go to the emergency room.
So this one is one that has nothing to do with vaccines. It's a question that I have from ours because I've heard the old cowboys tell me one thing and the label says another thing, and it's about Poron. Can it freeze and still be effective, or does freezing, even though it has the alcohol in it, garner that it's not effective?
That is a really good question because I see people that just leave it hanging on the chute, and then you come back and it's a different color, and it definitely can get denatured. It has to get really cold for it to freeze, the stuff that has a lot of alcohol in it. Um, but saying that, um, I think it would have to freeze really solid, and it would have to be very cold. But yeah, you shouldn't be leaving it at the chute or a place. If you can store it over the winter, you should bring it in, that kind of a thing.
You just answered so that we were both right. You Unless it's extreme. Okay. So last call for questions. If anybody has any more for Dr. Ryan, we've gone through what's on your list. Katie, the last one that I had for you is just, you had those protocols out there that were great to sit with people, and I joked about if we could just hire you to come and do that chat through before we all work, and we could have somebody do the safety discussion, then we can come in and do the vaccination protocol discussion. But the reality is that everybody's always so often in a hurry. We try to make ourselves slow down to take these steps, but it doesn't always happen as perfectly as it could or should. So if you had maybe just one, two, three key things that if somebody was brand new to vaccinating and they do end up getting that gun on branding day, or it's somebody that's just trying to learn these ropes now, what are the most important take homes you have for somebody out of all of this?
I'll go back to what I said before. I think the analogy of treating the vaccine like you would your beer is like people get that. You want to keep it cold, you want to keep it in the cooler. And then just checking to make sure you're giving it IM or sub Q. And a new person, you'd have to show them the angle, like this is how you do IM or sub Q, this is how you do IM. And then when to change the needles and what to do with the needles that are used. Like, do we put the cap back on? Do we throw them in the back of the pickup? Do we have a box for them? Like, what you're supposed to do with the used needles. Those are the main things, I think.
And I loved your bubble solution too, to shoot it back into the vaccine so you're not wasting a bunch of vaccine trying to chase that elusive bubble out of the gun.
Right. Exactly.
We did have one more question, and this is what about giving multi-min with two vaccines? Would that be too much?
No, generally that's fine. The only time I do hesitate to give multi-min is baby calves. I have people that maybe they're giving a C and D at birth and they decide to add multi-min, but the dose for baby calves is 1 ml per 100 pounds. So a lot of people just give 1 ml. And say if you've got a 60, 70 pound calf, that's a pretty big overdose. And the history I get from ranchers is, well, vaccinated them just like we always do. I gave them a shot of multi-min and I came back 2 hours later and it was dead. So you can OD them on multi-min and don't think that you can't, but um I definitely on our own cattle will give them multi-min around weeding time just to sort of boost their minerals and help them respond to the vaccines and whatnot. And so we'll do a multi-min and another vaccine on one side, and then we'll give the other vaccine on the other side of the neck. And we've never had any negative effects. And really, you shouldn't. Um, the other thing about giving vaccines at birth, if you are going to do it, it's better to do less than more. So if you have the option between alpha 7 or alpha CD or something like that, you would want to choose the CD. And then you just have to give them the rest of their blackleg and whatnot at branding. So some people would use that as one of the blacklegs, and then they would do one at branding or weaning and not, because you want to have two in before they go on to the rest of their life. So they would count the birth one. But if you have the option, it would be better to do less and to just do a CD and not the whole 7-way.
So that really goes right into this last or the next question. I'm not going to say last until they quit coming in, but we've got a question that's where do you most often see producers either over vaccinating or not vaccinating enough?
So when I first started 20 years ago, I saw some producers under vaccinating. And I even like I would call with different herd outbreaks, I would call different researchers and say, this is what we have. And they called me about 5 years ago because they wanted to do some research on unvaccinated herds. And they said, some of those herds you have that don't vaccinate. And I'm like, they vaccinate now. So we don't see under-vaccinated animals very often, but we often see over-vaccinated animals. And I think that's where it's good to sit down with your vet and be like, this is our risk. This is what we struggle with. And then target those things. Don't just, if there's a new vaccine out, it doesn't mean that you need it. But if you're having trouble with something, that is something that you would want to approach is maybe trying a new vaccine. Um, there's just so many management things that you can do that are better than vaccines, but we tend to try to look for some of the solutions in a bottle. And those always aren't the best solutions, and we can really end up overwhelming the calf's immune system. So, yes, definitely over vaccinating is what I see now.
We'd like doing a human health seminar or a livestock seminar here as we're talking about overwhelming medications. I know that sometimes you look at people's collections that they have on their kitchen counters and it's pretty extreme. So, um,
Yes.
Kathy wants to know, what is your thought on giving 1 cc of Endovac at birth?
So we actually don't have very many herds that do that, but we have one herd that does it, and um, it seems like it's really has helped their health, and there's really no scientific evidence behind why this would work, but their cases of diphtheria have gone down a lot since we started doing that. And they always struggled with diphtheria. And for those of you that have had calves with diphtheria, you know how hard it is to treat them and how they often don't respond to treatment. And it's hard to watch them struggle to breathe so much. So we don't use a ton of it, but in the cases where we've used it, it has worked well.
What recommendations do you have for a vaccine protocol at birth?
Okay, so that's a really loaded question. And it just depends on so many different things. So I'll ask the producer, what problems do you have before branding? And if they say pneumonia, which doesn't happen very often, but it does sometimes, then maybe we'll do a nasal genic branding or at birth. If they say overeating, then we'll either change the cow vaccine or we will do um, a C&D at birth. Or we make a ton of autogenous vaccine that has Clostridium types A, C, and E in it. So you can't find commercially the types A and the types E, but we have cultured them from our customers' herds. And so we were able to grow cultures and send them to a lab that made a vaccine. So we actually are starting to sell more and more of that type every year just because it's sort of the local strains of what we're actually seeing. So that's probably the most common one we do is our AC and E vaccine. But just in general, it would either be a 7-way or a C&D shot or possibly an intranasal. And then if the cows aren't vaccinated and maybe they're heifers calves, and maybe you didn't get the scour shot in, maybe you don't like scour shots because they sometimes cause the cows to lose a calf and you have to run them through, and sometimes the chute's full of snow and things like that. So in cases like that, we might do the calf guard or something like that at birth to help protect them. First defense, even a half dose of scour guard we've used in some places to help prevent them from getting scours.
So we had
Depends on your risk.
in northern Montana last year, we had a weather event right in the midst of everybody trying to precondition calves. And I forget what the temperature change was, but it was an extreme, like 40-degree temperature drop for 2 days and then got back warm again. And a lot of people already, you've got your preg testing and your preconditioning. It's already on the calendar. Your vet doesn't have time to wiggle stuff around. So we had calves that were coming into that situation with definite you know, pneumonia-like symptoms, definite respiratory symptoms, hanging their head, drooling, having a hard time making the move. At what point do you make a call that's we're not going to vaccinate these animals? They've had too much stress on them. Maybe introduce an antibiotic at some point with those symptoms because it put a lot of folks into a hard spot. I know we lost one of our steer calves after it. It just was too much stress on his system. He didn't get vaccinated, but just the move and everything overall was too hard on him. So when you have those sorts of weather events and you have everything planned, at what point do you pull that plug?
Well, as a veterinarian, I love it when people cancel on days like that because I used to hate it because I was trying to fit so much in. But now that I'm older, I hate working cows on days like that. And it is hard on the calves, and they're not going to respond to the vaccine as well. And you're going to have some kind of a cutoff, like whether it's 10% or whatever, or maybe more. But if you have a large number, and I've had this happen before with Bangs vaccinating, where a large number were sick, and so they're wanting to give them a shot. Well, then, especially with Bangs vaccine, because it's a live bacteria, the vaccine won't work. Like, you just need to decide we're going to do this on a different day because they're not going to respond to the vaccine, and it's too hard on them and too hard on everybody. But yeah, you just have to have a threshold, and that's probably different for some people. But for me, it would probably be around 10 to 20%. And if that many were sick, I would say we're going to do something different. We're going to doctor the ones that are sick, or maybe mass medicate everything, or do whatever. And then we're going to give them their shots after they're cleaned up.
Okay. Well, we've got Jean wants to ask an audio question. So Jean, go ahead and you can ask your question to Dr. Ryan.
Okay, great. Thank you. You've mentioned a couple of times that the vaccination between birth and branding, which I assume is roughly 30 days or so, but you've mentioned about overeating. So it's been 40 years since I've run cattle, but within sheep, we'll do the overeating at about the 30-day period, because that's when they're really moving off of the milk onto starting to graze. Is it similar within the cattle? What I'm hearing you say is a little bit different than the protocol we would use for sheep, but I would think that when do those calves really start grazing where they're going to get more exposure to risk of the overeating?
So what we notice more in cattle is that they get overeating after a storm. So and they don't have to be on grass to get it. We have had people that have had trouble with it at 3-4 days of age. And in those cases, we've even went to giving the antitoxin at birth, because it's the antibodies itself. And that was the only way we could prevent them from getting overeating. So what we typically see is a storm, maybe a calf is laying around cold, doesn't go nurse. Then it warms up and they go nurse, and they get a bacterial overgrowth in their stomach that goes into their small intestines. And then they start producing those toxins from the Clostridium perfringens. And in cattle, it's typically type C, although we have got some type A and some type E on cultures that looked like they were actually causing disease. And in sheep, it's usually type D. So that probably is a little bit different in the clostridial area. But in cattle, we often see it before 30 days. We often see it before they're on grass, when they're just only nursing. And it's usually related to some kind of a stress event, which is most likely weather.
Okay, as a follow-up, if you don't mind, a lot of people are vaccinating their ewes, sheep, 30 days or 15 days in advance of birth, hoping that the antibodies will get passed through the umbilical cord to the lamb. Is that a practice that's done within the cattle?
Yep.
So
A lot of people do that. So they'll do some kind of a vaccine. We're going to do ours, like I said, this weekend. A lot of people do it 3 to 6 weeks before calving, sometimes farther out, depending on the vaccine. If it's oil-based, it takes longer for the cow to absorb it and get it into the colostrum. So sometimes they'll even do it farther in advance of calving. But yes, we definitely do that. It's just that sometimes people don't have enough help. Sometimes they don't have the protocols and they start having a problem. So we do the things at birth in those instances.
Thank you to Dr. Katie Ryan for helping us out. We're hoping one of those tools that you can rewatch or you can recommend to somebody that's helping out on your operation. Just always good lessons to have. Still coming up in the Rural Resilience Series for 2026, February 19th, Ranch Water. We're going to be talking about low-tech, high-impact restoration. And then on March 5th, sheep industry takeaways for beef. You can get yourself signed up if you'd like to watch those webinars in real time at ranchstewards.org/events. If ranching, conservation, and strong communities matter to you, you are in the right place. Subscribe to our YouTube channel and be part of a winning team for agriculture and working lands.